My name is Hamza Hassan, and I'm a faculty member at Roswell Park Comprehensive Cancer Center in the Division of Multiple Myeloma. I see and treat patients with multiple myeloma, amyloidosis, and related plasma cell disorders, and I do translational clinical research in multiple myeloma. I went to medical school in Pakistan. I did my medical oncology and hematology fellowship from Boston, Massachusetts, primarily at Boston University and also at Dana-Farber Cancer Institute. I choose myeloma as my specialty based on my early interest in medicine that stemmed out from my interest in biology and genetics, and the understanding of the biology of how our normal cells work. Oncology overall, and specifically myeloma and amyloidosis, is essentially the science when it doesn't work the way it is supposed to. As a physician, I think it is important for me to be engaged in a field where I'm able to offer something to the patients that will help them live longer and live life to the fullest. There's a lot of research and investigation that allows us to offer a lot to our patients, and it's wonderful to work with optimism in our field. I think there are many things that are exciting, and there are newer, novel combination regimens that are being tested here at Roswell Park in collaboration with so many other centers. Other new exciting things is actually immunotherapy. Essentially, what immunotherapy does is there are techniques and drugs where we can harness our own immune system to help identify cancer cells which have camouflaged themselves during the course of development. So I think I'm very excited about what the promise immunotherapy, CAR T therapy, which is chimeric antigen receptor T cell therapy, and newer drugs like bispecific antibodies hold. And with a lot of promise comes with a lot of prospects, and we have seen unprecedented response rates with these medications. One of the unique things about Roswell Park is that it is the only comprehensive cancer center designated by the NCI in the Western New York, which gives us the ability to really focus on individual cancers. Like in my group, for example, we only see myeloma and amyloidosis. It gives us the ability to be at the forefront and to take a lead in the development of the new standard of care, which is newer, more effective by the way of clinical trials. A lot of the work that I do is to collaborate with other scientists in order to understand the disease much more better by making scientific discoveries. And in the bigger picture, this helps us develop new life-saving treatments for our patients. This aligns with our institutional goal of unleashing the power of hope, and I would say also of science. My hope is that what we do here changes care everywhere. There are many things that I love about my job. We have a fantastic team here whose sole focus is exceptional patient satisfaction, and they go above and beyond to make this challenging time as smooth as possible. Cancer doesn't affect just one individual. It affects their family, it affects their work, it affects everything in their life. As a physician, I think that what drives me is the bond that I kind of creates with my patients and their families along the way in their journey. I want them to know that they're not alone in this, and we are here to help them and guide them throughout the way.